Okay. Uh, Hello, everybody. Myself, Dr. Sushant Kumar Bhadatya. Myself, working as a consultant, neonatologist, and pediatrician at Apollo Cadel Motinagar, New Delhi. In this Facebook live session, today we'll be discussing some facts and myths about neonatal jaundice, a common condition we parents or physicians encounter in neonatal period. Um, before we go to the myth and facts section, first I would like to discuss some physiology or some process why babies get jaundice in the neonatal period. um, Basically, as a human body, every baby, neonate or adult, their body RBCs undergo a breakdown process, and the breakdown of RBC results in production of the bilirubin pigments, which body tries to excrete through to process through the liver, and then they get excreted through stool and urine. So what happens in our body? The liver is mature enough to take it out all these debris, but in neonatal period, till baby was inside the mother's uterus, the jaundice pigments are cleared up by they taken care of by the mother's liver. But once babies get delivered, their liver system, particularly the enzymatic process, which convert the bilirubin pigment into the soluble pigment which get excreted in the stool urine, are not matured enough. So the jaundice production is there, but that system is not capable of excreting it out. So the jaundice level gets increased day by day, and every level of jaundice is not going to harm the baby. Particular level, when it crosses, then it has potential to harm the baby's brain. So basically, we are trying to identify the condition of jaundice and treat it to prevent the jaundice getting stuck into the brain matter, leading to permanent neurological damage. So, what are the basic myths associated with the jaundice? So, parents often doubt that when baby is affected by jaundice, that my baby is ill or baby is sick. But fact is that rarely, in contrast to the adult jaundice scenario, where jaundice means the liver has compromised due to either a metabolic issue or either due to an infectious issue that leads to jaundice appearance. But in babies, it is mostly due to the immaturity of the liver enzyme system, and not due to the sickness alone. Uh, Almost all babies, all preterm babies, and nearly around 80% of the term babies get affected by jaundice. And visibly, jaundice means baby's blood level has has risen up to 5 milligram per deciliter, and this jaundice level always is not going to harm the baby, as we discussed, and particular limit it has to cross, and that limit depends upon the age of baby and the maturity of baby. So next myth, second number myth, that babies, all level of jaundice is harmful for babies. So this is not also true. The level of jaundice that is going to harm the baby is decided or is dependent upon the level of maturity the baby has attained, like the age of baby and the gestational maturity. And this is decided just to assume that baby's blood brain barrier is not allowing the significant amount of bilirubin to cross into the brain matter. So like 38-week onwards, the babies are mature enough to tolerate even 18 milligram per deciliter by day 5 of life. Until day 5 of life, the level of jaundice depends upon the hours of life. So there is predefined charts which is issued by the definite academic bodies that help us decide what level of jaundice is going to harm. So like 13 milligram or 13 points of jaundice at day 1 is definitely harming baby, but not at day 5 of life. So the level is to be decided by the physician depending upon the given clinical scenario and the clinical condition of baby. So you should definitely approach the physician alone, rather than deciding alone how to judge the severity of the jaundice. Third myth is associated with the that uh, breastfeeding leads to the jaundice in the baby. So very these are the conditions where baby is not nursed properly. Like there are two type of breast milk associated jaundice. Like one is breastfeeding jaundice and one is breast milk jaundice. Breastfeeding jaundice means that baby is not nursed properly in the initial few days, like first 5 to 7 days, where the enterohepatic circulation or the internal circulation of the jaundice is persistent, so leads to uh, excessive jaundice rise. So it is not related to the any content in the milk in first week of life. So proper feeding, like baby is not going to baby is not lost his weight, then it's not related to the breastfeeding alone. And in the third week or fourth week life, some pigments in the breast milk leads to sustained elevation of the jaundice level in the body, but not enough to cause any harm of baby. But that leads to a jaundice appearance of babies for a prolonged period. That is called breast milk jaundice. For that reason alone, we never advise to stop breast milk feeding, but you should consult your physician. Some because some other conditions like conjugated hyperbilirubinemia condition, there may be persistent of jaundice beyond 3 weeks of life, which needs subsequent evaluation of the direct fraction, and the treatment should be given accordingly. Fourth myth associated with the jaundice is that mother's diet, like inclusion of turmeric or papaya in the mother's diet, or inclusion of some yellow lights in the house, or some yellow clothes in the baby, will lead to increase in jaundice level. But as we discussed, this appearance of jaundice is related to immaturity of liver system. Nothing related to the outside environment has impact on the level of jaundice. Neither it will decrease, neither it or it will increase the level of jaundice in the baby. Uh, fifth myth associated with the jaundice is that every baby needs treatment. So as discussed, those babies whose jaundice level crosses the threshold for the harming the brain, those babies only require treatment in form of phototherapy. There is no other therapy apart from phototherapy, like only or any kind of medication to mature the liver. So we only focus on decreasing the intensity of jaundice inside a baby, so that baby's body is not going to affected the body by jaundice level. So aim is to control the jaundice level rather than to cure the jaundice. So because as we know, with time, uh, baby's liver is definitely going to mature, and it will take care of the jaundice level subsequent week of life. So phototherapy, and rarely some babies need the blood exchange to reduce the drastically increased bilirubin level inside the body. Sixth myth associated with the jaundice treatment is that once baby has received phototherapy, it is not going to recur in the baby. But fact is that some baby, like not most of them, but around 20 to 30% of baby may need second session or third session of phototherapy, depending upon the how early the bilirubin is increased. Like if the baby is received phototherapy on second or third day, it is definitely there is chance that baby may need another phototherapy session in subsequent 2 to 3 days, as the liver is not matured enough. So whatever jaundice we achieved level achieved by the phototherapy level, it is going to rise again, because till then the baby's liver is not mature, so the jaundice pigment get accumulated in the body. Once the liver system gets enough matured, then without phototherapy alone, with the phototherapy, it will be excreted. So and there is no medications. The parents often ask, despite of such advancement in medical science, there is no medications needed for phototherapy. Apart of phototherapy, there is no medications available for jaundice, because these oral medications have more side effect or indefinite effect, rather a safe effect on jaundice decrease. So these are not advisable for the admission of the baby. Uh, seventh fact, seventh myth associated with the jaundice is that every jaundice is benign. So around 90 to 95% jaundice, it will recover in 2 to 3 weeks of life, mostly in first 2 weeks of life. But few babies, the jaundice level may persist beyond 3 weeks. As you discussed, apart from a benign condition like breast milk jaundice, uh, these babies, those have persistent jaundice beyond 3 weeks of life, they should be evaluated for the conjugated jaundice. Like there is inability to excretion of the jaundice via the gut. So their liver is mature enough, but they are unable to excrete out. That this results in conjugated jaundice. That results in dark urine and pale or white clay colored stool. So that is some ammonia condition that needs to be addressed as soon as possible. So any baby having persistent of jaundice with some this kind of clinical features like pale stool and dark color urine, they should be evaluated for the subsequent workup. And now the myths, apart from the this kind of myths, we should always focus on the guidance by the doctor, rather than some advice from the neighborhood. So most of time neighborhood ask parents to rely upon the sunlight therapy. So last myth would like to discuss that sunlight therapy is going to cure the jaundice part in all babies. The fact is that uh, uh, we have learned the mechanism of jaundice clearance through phototherapy from sunlight therapy only. There is a curious observation that those babies who were exposed to sunlight, they have less jaundice. But that is not a therapeutic option nowadays, because sunlight is very ineffective when the jaundice level is enough to harm the baby. That the jaundice level has crossed the threshold level. Baby's brain is going to harm with the level of jaundice the baby has accumulated. So that is not the right time when we can rely upon the sunlight. So when baby's jaundice has increased beyond threshold level, then sunlight is not a therapeutic option, and you should admit the baby for the phototherapy. And even if pre-threshold period, like baby's jaundice is not rises to the threshold level, but the jaundice is bit less, you parents often prefer to keep the baby in sunlight, but you should uh, take a precaution that during sunlight therapy, babies may get heated up, or baby may get cold due to the environmental conditions, and the direct UV rays may harm the newborn skins if kept for prolonged period. So benefits are minuscule or non-existent, but risks are definitely higher. So we never advise for sunlight therapy for treatment of the jaundice. So this with this kind of myths we encounter, we always counsel parents to discuss with us whenever they have doubt. And we can, I think we can take up the questions now. So first, our viewer has asked, is there a jaundice caused due to breastfeeding? In that case, we had not breastfeed once the baby is recovered. So, breastfeeding alone does not increase the jaundice level, but poor breastfeeding, we are adamant that babies only to be breastfed, and so you should be ensure that even if we breastfeed, we should ensure that baby is getting enough milk and baby is passing urine enough time, and not losing weight, so that the poor breastfeeding is the factor for jaundice, not breastfeeding. And once baby is recovered, we definitely go for breastfeeding. Breastfeeding has multiple of benefits, so breastfeeding never be stopped for fear of recurrence of jaundice. So we always encourage breastfeeding, frequent breastfeeding, that will help both mother, baby, and clearness of jaundice. So second question is, post recovery, are the chances to recover? Definitely, depend two conditions. Even if there is baby has no coexisting comorbidities, jaundice will rise till baby's liver is mature enough. So baby's liver mature to be mature, it takes around 7 to 10 days in term babies, and 10 to 14 days in preterm babies. For fully mature enzyme system, it may take up to 6 to 8 weeks. But in first 2 weeks life, this liver enzyme system is mature enough to take care of the jaundice part. So third question is, does jaundice lead to weight loss? No, jaundice never lead to weight loss. In fact, excessive weight loss due to poor nursing and poor feeding may exaggerate the jaundice level through enterohepatic condition called the enterohepatic circulation, so that the jaundice gets excreted into urine and stool, and it gets circulated inside the body only, and the level rises. And we have a question that, if I have a C-section, are there more chance of baby to have high level jaundice? No, science has not noticed such association, like whether vaginal delivery or C-section. There is no impact on incidence of jaundice in the baby. But if mother fails to feed baby in postnatal life due to some condition, that may influence the level of jaundice. Otherwise, our mothers, we always encourage the breastfeeding, and they never, if they never lose the weight, then there's no increased risk of jaundice for the C-section per se. Uh, what kind of precautions should we take once we take our baby home post recovery? So similarly, first precaution, you should ensure baby is getting enough milk, so that baby is not dehydrated, so since baby is passing enough urine and stool. Second, you should never miss follow up with your physician, so that any subsequent rise in bilirubin should be picked up early. Third, always follow the metabolic report, where we detect the thyroid, G6PD level, uh, and discuss with the physician, so that helps us being alert for jaundice detection. And never rely upon the sunlight alone. Even if you are going for sunlight therapy, never miss the screening for jaundice in uh, OPD. So, uh, how often should we get our baby checked once treated with jaundice? So once treated with jaundice, depending upon the risk factors, like if baby is in some blood group incompatibilities like RH incompatibility or ABO incompatibility, or there was enough increase in jaundice leading to a change in blood, or the level was beyond the exchange level, then doctor may advise you to follow up early, like 24 hour or 12 hour even. But if there is no risk factor, it is advisable to return after 48 hours. And depending upon the rate of rise, then subsequent follow up should be arranged. And once the baby's jaundice starts decreasing, then there is no need to panic unless the baby looks jaundice beyond 3 weeks of life. And last question I have here: um, if jaundice is severe, can it lead to loss of child during birth? I think the some babies, like in RH incompatibility, they develop jaundice in utero, but as baby's mother's body takes care of it, but there is production of excessive jaundice, loss of hemoglobin, and that leads to hydrospitalis. But apart from that condition, there is a RH isomerization and hydrospitalis, where the intrauterine hemolysis and intrauterine jaundice production is there. The loss of child is not due to jaundice per se. That is due to a condition called hydrospitalis. That is a condition I think there is chance of damage of the life of baby. Apart from jaundice, are never going to take baby's life. That is a potential damage, potential that have potential to damage the brain of liver, that leads to permanent neurological damage. So it's not a life threatening condition unless baby's jaundice is so much that baby's breathing and hemolytic system is affected. Otherwise, this is a neurologically affecting condition, so we should be always vigilant enough to manage the jaundice condition the baby. So I think we have no more questions. So if you have no more questions, I think we can conclude the session.